नमस्ते, सत श्री अकाल, केम छो? We are back with new episode at the TND Talks, and in today's episode, you all are going to know more thing with respect to our dental health. Uh, Many times we are not aware about many things which we should take care to have a good dental health, and there are few more things. आज हम अदिति जी से जानना चाहेंगे कि आपके टूथपेस्ट में भी नमक है और उनकी ये खूबसूरत हंसी के पीछे राज क्या है. So today we have a guest who has expertise in the dental, and she herself is a completed degree in BDS and MDS, and she own a Maple Dental Clinic in Ahmedabad. You guys, and location in the description. And so she is Dr. Aditi Choksi. Welcome, Dr. Aditi Choksi, on the show.
Thank you for having me and thank you for the wonderful introduction.
Yeah. So, Aditi जी, आपके स्माइल के पीछे किसका राज है?
So, I would say my dentist itself, because I didn't have this smile naturally. I had a very crooked smile. I had cross bites on both the sides, and I had got braces done. And after that, I got a aligned, proper, perfect smile. So, the reason behind my smile would definitely be my dentist.
ओके. सो आपने ये ब्रेसेस कब करवाए थे? अराउंड व्हाट एज आपने ये करवाए थे?
So I had got my braces done around in ninth or 10th standard.
सो ऐसा कोई बट भी आपने खुद ने भी 9th और 10th में जब होगे तब तो आपको आइडिया नहीं होगा कि आपने ये अभी क्यों करवाया है. बट आफ्टर
That's right.
कंप्लीटिंग योर स्टडीज, व्हाई डू यू थिंक दैट इज एन अप्रोप्रिएट एज कि तब लोगों को कराने चाहिए या नहीं कराने चाहिए? जो आपने जो डिसीजन लिया वो सही था या नहीं था? सो उसके ऊपर व्हाट इज योर व्यू?
So the ideal time of getting braces done is usually ninth to 12th standard. So before that it is too early, and after that people are usually conscious of getting the metal braces done. And obviously at that age you don't have that awareness yourself. In my case, my mom is a dentist, so she was aware about. That's why I got my braces done at in 9th or 10th standard. The
ओके, नो वरीज.
appropriate time of getting braces done is from 8th or ninth standard till 12th standard. After that, also you can get the braces done, but people are usually very conscious about the metal brackets visible. So people usually opt for an alternative treatment to get their crooked smile straight instead of the regular traditional braces.
ओके, ओके. सो जैसे अभी आपने बताया कि आपकी मदर भी डेंटिस्ट है और उसके गाइडेंस के अंडर आपके मदर ने एट दैट ड्यूरेशन वो स्टेप लिया विच वाज बेटर फॉर योर. सो क्या आपके मदर उस पर्टिकुलर, I would not say industry, but since she was more inclined towards the dental thing, so what motivated you to study dental aspects, and rather than other arts, engineering, all other aspects were also available?
I used to accompany my mom as a child and see her do patients, and that really fascinated me. वो देख के मुझे ऐसा लगा कि this is something I would like to do for the rest of my life. Yeah. Other fields, maybe I didn't have the exposure or I didn't see how the fields are. So this was something that I have been seeing since a very young age. So this was something that was fascinating me. And I didn't want an emergency branch. I always wanted a branch that I can appoint patients and do it by appointments.
Okay, okay, yeah. So this was like you have been associated working with your mom when you were a small child and growing with the same environment that has helped you to think to get into this industry. But do you think anytime that being a dentist, like every day you see the same mouth, right? Today, today you must be seeing 7 to 8 different kind of mouths of child or older age, mid young age, or people with chewing tobacco, like it's a completely mess in the mouth. Don't you get irritated?
No, actually, if you see to it that any profession you have to do something repetitively. If you are a restaurant owner, you have to see food every day. If you are a car dealer, you have to see cars every day. So same way, even in doctors, whatever specialty you have to see that every day. So no, in fact, that is teeth are the something that I notice first in a person. Even if I meet someone at a party or a wedding, it is usually the first thing that I notice in a person also. So it is not something that you get bored of. It is just something you are used to.
Okay, so even if you want to make new friends, so you look teeth of your friend that if it is aligned, then you will make a friend, and if not, you will not make a friend like that.
No, if the teeth are aligned, then definitely that's fine. But if teeth are not aligned, then first they'll become my patient and then the friend they are. So,
हाँ, ओके. सो क्या आपके टूथपेस्ट में भी नमक है? सो आप जो भी टूथपेस्ट यूज करते हो उसमें भी आप नमक वाला यूज करते हो?
so टूथपेस्ट में नमक से दांत ज्यादा अच्छे होते हैं ऐसा नहीं होता. This is all a marketing gimmick basically. Salt or neem or clove or anything with these ingredients in a toothpaste don't make your teeth any more better. Actually, it's about the habits. If you brush twice a day, uh, you rinse your mouth after eating, those habits will keep your teeth better in better condition than these contents like namak and all.
आप आपका ये कहना है कि नमक होना ना होना टूथपेस्ट में उतना इम्पोर्टेंस नहीं रखता? क्या ये मैं ये समझ सकता हूँ?
Yeah, your habits are more important. Contents से ज्यादा habits important है. नमक हो या ना हो पर अगर आपकी habits अच्छी नहीं होगी तो you will definitely get caries in your teeth.
And can you tell, being a dentist, what should be the regular dental checkup should be done in a 1 year? Like it should be once in a year, twice in a year, or what all things do you think that it is necessary for a person to follow?
So a patient should get their regular dental checkups done every 6 months. It is recommended, but usually the trend is that patient comes to us only after it's too late. They come to us when their teeth are paining, and till it reaches the stage where the tooth is paining, it has already become too late. So uh, if they get regular checkups done, so if there is any, even the initiation of any caries or cavity, we can detect it and just remove it, and just it will just get be done by a filling, and you'll not have to get a root canal or any prolonged treatment done.
जैसे अभी आपने बात की कैविटी की, तो ये कैविटी क्या होता है?
Cavity is so basically in teeth has three layers: enamel, dentin, and pulp. So when the caries that जो सड़ा बोलते हैं वो जब इनामल या डेंटिन तक फर्स्ट टू लेयर्स तक जाता है तो वो एक ऐसे खड्डा जैसा बन जाता है जहाँ पे खाना फंसता है. तो वो निकाल के फिर उसको फिलिंग कर देते हैं. अगर उससे ज्यादा आगे बढ़ता है तो मूल्य की सारवार करानी पड़ती है. So basically, to answer your
Okay, okay.
question, cavity is sudden in a very simple way.
So can you give top three habits
Hmm.
for an individual to avoid this kind of cavities or cavity related diseases?
So the first is the very cliche that every dentist suggests, that you should brush twice a day. People brush in the morning, but people skip the brushing in the night. पूरा दिन जो खाया होता है वो दांत पे रहता है. So it is very important and mandatory that you brush in the night as well. And apart from that, you can just gargle or rinse your mouth after you have any high carbohydrates or sugary food, so that it doesn't stay stuck in your teeth. And you should have high fibrous food, healthy food, raw vegetables, fresh fruits. That will keep, and also stay very hydrated. These are the basic things that you follow. It will keep your oral health good for a very long time. And the most important, dentist checkup every 6 months.
Okay, okay, got it. So now you talked about कि दिन में 2 बार ब्रश करना चाहिए कोई भी इंडिविजुअल को। तो हम लोग काफी बार फटाफट यूं यूं करके खत्म कर देते हैं। तो इसका सही तरीका कैसे होता है? क्या हम लोग यूं 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 करके 2 मिनट में खत्म कर दिया तो इज द राइट वे, और इज द नहीं वी आर डूइंग इन अ रॉन्ग वे?
So brush करने, usually I've seen a lot of my patients brush very rigorously like this, that उससे उसकी वजह से दांत घिस जाते हैं. तो आइडियली रूट से क्राउन तक, मतलब ऊपर, सपोज ऊपर के दांत है तो इस मोशन में ब्रश करना चाहिए. रूट से लेके क्राउन तक, और नीचे के दांत है तो फिर ऊपर ऐसे ब्रश करना चाहिए. और इसके अलावा यू कैन जस्ट डू सर्कुलर मोशंस आल्सो, either this or either that, but not the rigorous this one brushing. It damages your tooth, दांत घिस जाते हैं.
Okay, okay. And there is one more thing I think one of my friend is using this automated like battery operated brush which has recently came into the market. So he purchased from abroad while he was traveling to different country, and he
Mhm.
purchased for more than 150 bucks, almost 8 to 9,000. So, do
Yeah.
you think that that electric brush and the normal manual brush which we regularly everyone does, so does that make any different impact on our teeth, or it is the same at the end of the day?
So usually a lot of my patients who have put very high pressure while brushing, brush करते हैं बहुत pressure लगा के brush करते हैं तो दांत घिस जाते हैं. तो उनको I recommend कि they use electric toothbrush, जिससे उनके दांत पे कंट्रोल मोशन, कंट्रोल प्रेशर है. इलेक्ट्रिक टूथब्रश में वो लोग ही प्रेशर यूज करते हैं. You just have to move it around. But apart from that, if you can afford, अगर afford, electric toothbrush is definitely more costlier than the manual one. So if the patient can afford, it is definitely 100% way, way, way better than a manual toothbrush.
Okay,
And
because
if you don't, if you use a manual toothbrush, the proper method of brushing is important.
okay, okay. So since you own your clinic, you must be getting patients from normal child to elderly aged people. So
Yeah.
what kind of diseases or problem is more frequent in children? Children, I mean to say age less than 12.
So in very young age people, 1 or 2 year old, the most common is what we call in dentistry, that is nursing bottle caries. उसमें क्या होता है कि बच्चे वो दूध की जो बॉटल होती है वो शुगर वाला दूध होता है, तो वो दूध की बॉटल लेके सो जाते हैं। सो वो पूरा शुगर वाला दूध पूरे उनके दांत के आजू बाजू रहता है पूरी रात। सो बिकॉज ऑफ दैट उनके सारे दांत इवेंचुअली ओवर टाइम सड़ जाते हैं। So that is the very common thing we see in our patients. Apart from that, we also see that a lot of patients, young kids, are very fussy about getting their teeth brushed, and parents have this mentality that मिल्क टीथ है, ये गिर जाने वाले हैं, तो इसमें शायद वो ब्रश करने ना करे किड, तो फिर चल जाएगा, नए दांत आने ही वाले हैं। बट दैट इज नॉट ट्रू। They should make sure that kids have good habits from a very young age, and they brush their teeth, because even the deciduous teeth get decayed, and they also can have caries and can get painful for the child. So these are some of the very common things that we see in a child. And apart from that, we also see that uh, the old deciduous teeth don't fall off at the right age. So permanent teeth erupt from a different place. So because of that, there is a lot of crowding.
Okay,
Yeah.
okay, right. And so you have shared the diseases which is occurring at the children age, and you have also suggested the solutions which can prevent all these diseases, and they can get sufficient information how to minimalistic damage could be done to the children. So in the similar fashion as you shared with respect to children, so in the elder
Hmm.
age, I so in which age group you see more diseases, either it is a children or a elderly age? Elderly, I mean to say senior citizen 60 plus.
If you just compare that data, that statistics, that will obviously be people, old age people, because they have not just uh, young age people have issues because of their habits, not having good oral hygiene, or not keeping their teeth good. But in the old age, it is also because of the aging, because of the receding bone. Also, there is teeth start moving and fall off. So obviously, in the old elder age, we see more tooth problems.
Yeah. So one more thing was that when my friends are having some good occasion or some celebration, so they always go to cleaning their or whitening their teeth, because sometimes they eat pan or something else. So because of that, it is yellowish. Or people who are chewing tobacco, those guys go for frequent visit of white cleaning. So is it a good for any individual? Right.
The teeth whitening products that the people use, that are directly ordered from the online products, direct to consumer products, that people do teeth whitening at home itself, that is harmful. But the teeth whitening that you get done at a dentist clinic, chair side, that is completely safe, because there the dentist takes care of uh, creating a gingival barrier, और वो जो गम होते हैं उसका ध्यान रखते हैं। uh, उनको दांत घिस ना सेंसिटिविटी ना हो जाए उसका भी ध्यान रखते हैं। पर जो प्रोडक्ट्स लेके यू डू इट एट होम योरसेल्फ, उसमें ये सब चीजों का ध्यान नहीं रहता, तो उसमें सेंसिटिविटी होने के चांसेस बहुत ज्यादा होते हैं। इनफैक्ट वी हैव अ लॉट ऑफ पेशेंट्स हु कम आफ्टर यूजिंग दिस प्रोडक्ट्स एट होम, they use it on their self and they have severe sensitivity issues, and then they come to us, and then we have to treat that. So it's better that you are wise enough and you directly go to the dentist and get the teeth whitening done, instead of falling for these marketing gimmicks.
And what should be the appropriate frequency if anyone wants to do a whitening of teeth?
So it actually it's very much dependent on the patient's habit. If the patient has a regular habit of having tea, coffee, caffeine in any form, then they are more likely to have येलोइश ब्राउनिश टी एंड अगर पान मसाला गुटखा तम्बाकू खाने की आदत है तो भी रेडिश टाइप ऑफ होते हैं दांत. So it is more about that your habits rather than what these things. Teeth
Okay.
whitening. But ideally, if you have normal habits, then once you get the teeth whitening done, then you don't need to get it done for a few months at least. And it's not
Okay.
that if you
Okay.
get a teeth whitening done, it will just suddenly one day you have very yellow teeth and next day you get extremely white teeth. Uh, but so it's just what shade teeth you have, it just gets two shade whiter.
Okay. Okay. Yeah. And so, does this teeth whitening create a space in between two teeth? दो दांत के बीच में जगह करता है whitening करवाने में.
नहीं नहीं टीथ व्हाइटनिंग से जगह नहीं होती पर अगर अच्छे से नहीं करा है तो सेंसिटिविटी इज द ओनली इश्यू दैट कॉम्प्लिकेशन दैट कैन अकर अपार्ट फ्रॉम दैट दो दांत के बीच में जगह बिल्कुल नहीं.
ओके. सो जैसे मैं हर हर इंडिविजुअल की लाइफस्टाइल अलग अलग रहती है, राइट? सम पीपल वर्क इन अ वेरी कॉम्प्लेक्स एनवायरनमेंट एंड वेरी प्रेशराइज एनवायरनमेंट. सम पीपल हैव अ नॉर्मल डिसेंट, they don't have that much amount of work pressure or anything, and
Hmm.
normal life is there. So
Yeah.
लाइफस्टाइल का असर ओरल हेल्थ पे पड़ता है? अगर पड़ता है तो किस तरह से पड़ता है?
स्ट्रेस की वजह से कई लोगों को अल्सर्स हो जाते हैं जो चांदा बोलते हैं मुंह में. वो किड्स में बहुत फ्रीक्वेंटली देखते हैं उनको एग्जाम के टाइम पे स्ट्रेस अल्सर्स हो जाते हैं एंड एज सुन एज द एग्जाम्स गेट ओवर दे आर बैक टू नॉर्मल. So that is very common. Apart from that, because of stress, if you consume any other form of tobacco or smoking, and if you get into those habits, then those affect and harm the oral health. Otherwise, directly stress से सिर्फ ये अल्सर्स होते हैं वो सब होता
तो एज टोल्ड कि अल्सर हो जाता है, राइट? सो इस तरीके से ओरल हेल्थ और सिस्टमेटिक कंडीशन लाइक हार्ट डिसीज, डायबिटीज, ब्लड प्रेशर, रेस्पिरेटरी इन्फेक्शंस, ये सब चीजें भी होती है अपने बॉडी में. क्योंकि बहुत सारे लोग डायबिटीज टाइप 1 टाइप 2 के पेशेंट्स होते हैं, और
है.
some people are already suffering with the heart disease. So how does the oral health affecting, because they have different ongoing diseases? Is there any connection?
Yeah. So the bacteria that infect the gums and that cause the gingivitis, yes, swelling in the gums, uh, and periodontitis, they also travel to the blood vessels uh, in other parts of the body. That it can cause inflammation and damage to the blood vessels near the heart as well, and it can cause tiny clots. So that way it affects the heart health. And apart from that, there are a lot of studies that say that diabetes causes dry mouth. If the sugar is not controlled, it causes dry mouth, or it causes that leads to more plaque formation, caries, everything. And that is, I would like to share one of the incidents where one of my patient, I noticed a clot in the mouth of the patient, and I asked to get as I asked my patient to get the necessary tests done, and it turns out that the patient had clot in his heart too, and patient got yeah. So I think all any systemic conditions or anything, first signs are seen in the mouth. So if you get a proper oral health checkup done, then a lot of things can be detected early on. So that was something very interesting thing I came across in a patient. We saw a clot in the mouth, and from that we predicted a heart attack, and which patient was able to avoid because of a regular oral health checkup.
Yeah. So this is a right case where if we, this is a benefit of doing a regular oral health checkup,
Definitely,
which can help us in
your oral
identifying
health
the
shows
sim.
all any sign. any systemic disease or anything happening in your body shows its first signs somewhere or the other in your mouth.
Yeah, yeah, completely agree that if you are a individual who is disciplined in a regular checkup, then you can get identification of other diseases also during your other checkups, that if something is happening wrong with internal setups, right? So you talked about all these diseases, and many patients must be visiting for either one of the cases or the other. So how do you make them comfortable and supportive environment for an each patient, कि जहाँ पे बच्चे हो, बूढ़े हो या जुआन लोग हो, जो आपको अच्छी तरह से रिस्पॉन्ड करें, और जो पूरी उनको जो पेन हो रहा है, उनकी जो पीड़ा है वो आपको सही तरह से बता सकते हैं, क्योंकि अगर पेशेंट आपको बता नहीं पाएंगे तो आप उसका निराकरण नहीं कर पाएंगे, राइट? सो आप किस तरह से वो एक ऑरा या एक एनवायरनमेंट क्रिएट करते हैं जिससे वो पेशेंट कंफर्टेबल रहे?
Yeah, so firstly, you have to be very mindful and know that the patient is most of the patients are usually scared of dental treatments and dental clinics. It is not some a very pleasing or something that they look forward to. They are always very scared, some or the other fear associated with it. So to calm them down, you can just first of all, what I ensured while I was while uh, we made my clinic with my architects, that we made sure that the environment and the vibe of the clinic we create is very comforting. The colors that we have chosen to everything, we have made it very less intimidating and very soothing to the patient. They come and they should feel peace and calm. Apart from that, when the patient comes, I you have to be a good listener and a good communicator. You have to listen to them, what their concerns are, what exactly they want to get done, and then communicate the entire procedure that is going to be done in their mouth. So that will, when once they are familiar with everything that's going to be done to them, they'll be less scared and they'll be more cooperative with you in the entire treatment procedure. And apart from that, we also have this facility where we let the patients see Netflix and their favorite shows on the TV. So while they're watching their favorite shows, their mind is distracted, and we get the treatments done. So they don't even come to know, especially the kids. They are watching their favorite cartoon and they are getting their dental treatment done, and the entire procedure is smooth for them as well as for us. And apart from that, also to keep the right empathy and good communication, and the most common thing the patient is afraid of is an injection or a syringe. So we have the special kind of syringe which is uh, causes the least amount, which almost causes no pain in the patient. So these are how measures we take to ensure that a patient has a smooth, comfortable, and a pleasant experience. And a lot of my patients, once initially they come with a fear, and after a few appointments they look forward to come to the clinic and get their treatments done. So I think that is the best thing I can hear as a dentist, that they look forward to come for their dental treatments, which they used to be
Yeah,
scared.
yeah, this is a great idea that you pacify the patient at the initial level itself, and you make a clear cut communication to the patient that how is the process is going to be. So during so there was like one incident happened with one of my friend few months back. uh,
Hmm.
so it was like unfortunate, but we have fight between the friend, and because of some verbal conversation that took place between outsider and one of my colleague, that has happened, and it turned into a fight, and that fight has broken the front teeth, like we have the front teeth, right? So वो front teeth उसका टूट गया था, and now he is facing issue that इसका मैं क्या कर, because it looks odd, he is still yet to marry. राइट? सो इसका कोई सॉल्यूशन है या उसको इजी वे that to get it fixed instead of filling out silver cement kind of thing?
So this is a very good question that you asked because there is a very lack of awareness about this thing, this topic, because but usually लोगों को ऐसा लगता है कि दांत एक बार गिर गया तो फिर गया, बट ऐसा नहीं होता. इफ ऐसे एक्सीडेंट से या फिर ऐसे मार खाने से अगर आपका दांत गिर गया हो तो वो बचा सकते हैं. So what you need to do is that when you get hit by someone or an accident and the tooth falls out, just pick up the tooth and hold the tooth from the crown. जो क्राउन और रूट जो होता है उसमें से जो क्राउन पोर्शन होता है वहां से दांत को पकड़िए और उसको मिल्क में रखिए, या तो फिर मिल्क अवेलेबल ना हो तो जस्ट कीप इट इन योर put a little saliva and put it there in it, and basically, and then just rush to the nearest dentist. So मिल्क या सलाइवा में वो दांत रख के नियरेस्ट डेंटिस्ट के पास चले जाइए और वो दांत फिर री इम्प्लांट हो सकता है.
Okay. So, since many advances has been happening, as you told that this is not aware to many individuals, maybe our viewers would be the key beneficiaries who are listening our podcast have been aware, and they must be using this thing if they are in such critical situation and if they are required to use. So, what are the top three technologies which you use in day to day life, right, to help your patient to get it in a right way or to give a bright smile? So what three technologies you use in your clinic every day?
So the basic technologies that we use are this the RVG for the X-rays, or those are the very basic technologies. Apart from that, the latest technology that we talk about, the AI or the digital dentistry that we say commonly. So in that, there is this previously we used to have this impressions, uh, very messy impressions we used to have, which were a powder and a liquid that is mixed, and an alginate impression is taken, and it is poured into the patient's mouth, and that's how the two teeth are recorded. And that used to get really messy. Now, with the upgradation, there is this new technology where a small camera is there, and it's called a scanner. The small camera just rotates around your teeth and it records the tooth surfaces, and uh, that has made the process really easier. So, and at first, when this impressions used to be taken, they used to uh, be taken, and then the lab person comes and collects it and then sends you the cap, and then that the process is very prolonged. The scanner thing, it's completely digital. We would just take the scan of the patient's mouth and teeth, and then that very second, that very moment, you just mail it and it just gets sent to the lab, and they can start the process that there itself. So the time delay is cut down, and apart from that, whatever the human error that comes in between, that is also cut down. So this is not just more comfortable and convenient for the patient, but it is also more accurate and precise for the doctor as well as for the lab person. So digital
Yeah,
dentistry has totally been a boon for the dentistry.
yeah, because the advancement in the technology has totally helped the doctor in terms of reducing the processing hours, time requirement, and it has efficient complete process, and patient don't needs to suffer a lot, and they get the treatment very quickly, right? So you talked about digital imaging and this treatment. So I think I have heard somewhere where I was reading out the blogs. So there I was seeing there was something new which is known as laser dentistry. So how does those laser dentistry is working, and where does it get help to an patient where anything happens, they can take advantage of this latest technology in getting the things fixed, getting the
So
things.
basically, laser dentistry is actually been there for a very long time. It was not that very commonly used, but it has been there for quite a time. So what it basically is that when you use some other tools or mechanisms to do the thing, then there is bleeding or a little pain. But when you do the same thing with a laser, there is none to very minimal bleeding, and it is absolutely painless. So those are the reasons that laser dentistry and laser has been so common nowadays.
And
So
laser treatments are costlier than the normal treatments or the
yeah,
normal
absolutely,
advanced technology.
absolutely. So for example, if a flap surgery is done using a laser, it it is more painless and less bleeding is present compared to if it's done in a regular normal way.
Can cavities could be removed using laser?
No. Cavities are removed by a completely different technology that is called an aerator. So that is a completely different thing.
Okay, okay.
Laser
Also,
we use
like,
on the gums. Laser we use on the gums, while aerator and all we use cavity and all happens in the teeth. So that for that we have different instruments.
जैसे अभी आपने बताया कि गम्स के अंदर वो डिसीज और वो रहते हैं, तो उसके अंदर अफेक्ट हो जाते हैं इफ वी आर ड्रिंकिंग टू मच ऑफ एरेटेड ड्रिंक्स एंड जैसे स्प्राइट हो गया, थम्स अप हो गया, कोक हो गया, राइट, बिकॉज इट कंटेन्स शुगर.
Hmm.
So if I drink that coke, it should not affect my gums and teeth, and it should not hamper. It should be at least healthy for my teeth, right?
So it is not just the sugary part in these aerated drinks that harms the teeth. It is also these drinks have a very low pH value, and lower the pH value a food or a drink has, higher the risk of it causing tooth erosion. Tooth erosion cause करता है इससे, तो उसके वजह से chances of caries, decay वो सब बढ़ जाता है और वो teeth को काफी harm करता है. So that is why it is usually advised that you should consume aerated drinks, cold drinks less because it damages your teeth significantly.
Because of acidic nature, we should consume less, and there is
Sugar,
no correlation
yes,
with the sugar.
yeah. Sugar also, the sugary drinks to directly harm the tooth and directly cause tooth decay. But the aerated drinks also have lower pH that also harm the teeth.
Okay, okay. And also, you talked about AI ML has been integrated in your advanced technologies. So, how does AI utilization is happening in current trend? And on top of that, what are the future upcoming trends are expected, or you see that if such kind of innovation research can happen, which could evolve as a drastic helpfulness for the dental ecosystem?
So the thing that have been constantly being used like the CBCT or it is exactly like the CT scan you get done, but this is just for the head and neck part, and it shows your entire head and neck in a 3D aspect that helps you to visualize the nerve and everything before the implant placement very well. And apart from that, there is also 3D printer coming into place in dentistry, where you can create the entire replica of the tooth or the jaw and everything, and also create guided plates which you can place it on the tooth on the jaw and then place implant. These are all making the dentistry more precise, and apart from that, the scanners that we talked about, that is also made dentistry very precise. And the new and upcoming thing that you asked about is robots are coming in dentistry. It has not come in India yet, but in USA they have specific robot that assists dentists in placing an implant. So you can place the implant, you can live see the implant placement being done on the TV. So that reduces the chances of complexities, or it makes the process more smoother and more precise. It has not been come in India, come to
Okay.
India.
But then bringing the robots into the ecosystem, don't you think dentist job is in danger?
So robots cannot place an implant by themselves. Dentists operate the robots and and place the implant. So dentists are definitely important and necessary, because where to place implants, how many implants to place, what size, everything cannot be decided by a machine. It has to be decided by the dentist, and it is dentist robot. It is just assist. It just assists the dentist to make it more precise. They don't solely put it by themselves.
Okay, okay. Sir, so and since we are talking much more of dentistry, this robotics aspect, talked many things about robotics, right? And the Gen Z. So when Gen Z people are visiting your clinic for their dental problem,
Hmm.
what
Good.
kind of what kind of diseases do you see which is more frequent in Gen Z?
Gen Z is the most frequent diseases that we see in Gen Z. Just give me 2 minutes. Uh, Gen Z's is that decays, because they are very fond of the junk food and aerated drinks and everything. So the most common thing that we see is decays and caries and everything. So yeah.
पता है तो बची
And
बात है
apart from that, they also get there is a very frequent trend of getting the aligners done these days by the Gen Zs, because braces are usually done till 12th grade or something. After that, people are conscious of getting their dental treatments done. So uh, they usually get their aligners done, and those are transparent thing that you wear on the teeth, and it cannot be visible even if you're sitting right in front of me. So that is something. Those are the common treatments that Gen Zs come to us to get done.
I think there are some brands who has come with the same solution. They are providing image like transparent aligners, right? So is it a safe for an any individual to just wear? So even if those caps are kept on the teeth, and while we are chewing the foods, it won't hamper and the it won't go into in between two teeth.
So it is obviously the direct to consumer. These products are direct to consumers, and if they are done by a dentist, it is definitely safe. But if it is not done by a dentist and done by a technician, it is definitely not safe. This company or any other company for that matter. So yeah.
Okay, okay. And so there was another thing that if someone wants to do braces at later stage, right?
Mm.
So after 40, 45, because they feel that the smile is not bringing smile on the other faces where they are eating. So do you think this is a good idea, or is it a safe to align those teeth at the older age?
So it depends on their teeth health. If their teeth are healthy, strong, and well, they can get aligners done and get their teeth aligned. But if it is not, then and if there are one or two teeth missing, then we can definitely offer other treatments like veneers or those smile designing treatments, which can make the teeth look proper.
So yeah, we discussed many things about this dental journey, right? So, but I have heard so many things nowadays that cancer is increasing day by day, and dental cancer, like I mean dental, not dental cancer, but oral cancer. Oral cancer is also proportionately increase along with the breast cancers, which are the prominent these days, which get identified in any individual. So how can we identify कि भाई हमको कैसे पता चले कि हमको ओरल कैंसर हो सकता है या उसके सिम्टम्स चालू हो गए हैं?
तो यूजुअली जब अल्सर्स होते हैं जो जानने पड़ते हैं मुंह में, तो वो 4 से 5 दिन में अपने आप ठीक हो जाता है। अगर यू हैव अल्सर्स जो 1-2 महीने से 3 महीने से ठीक नहीं हुए हैं, तो दैट कैन बी अ साइन। तो आपको एक डेंटिस्ट या कोई प्रोफेशनल के पास जाके जांच कराना चाहिए। उसके अलावा अगर आपके पास लाल पैचेस दिख रहे हैं, सफेद पैचेस दिख रहे हैं, वो सब हो रहा है, तो फिर आपको डेंटल के चेकअप के कराना चाहिए। मुंह खुलना बंद हो जाए, दैट इज ऑल्सो अ साइन कि अ, और बेसिकली ये सब चीजें टबैको, सुपारी, पान मसाला, गुटखा ये सब खाने पे होता है।
सो बेसिकली कोई पर्टिकुलर एज ग्रुप के अंदर ओरल कैंसर ज्यादातर पाया जाता है, या कौन से एज ग्रुप में यू आपको सबसे ज्यादा लोग मिलते हैं एज अ पेशेंट?
अ, सारे एज ग्रुप में मिलते हैं, ऐसा कुछ नहीं होता, पर ज्यादा एज ग्रुप में मिलते हैं कि सालों से अगर आपके पास तम्बाकू की आदत है, तो फिर वो कर होना चल वो होने के चांसेस ज्यादा बढ़ते
ओके, ओके। और इसको
हैं।
नहीं, इसके
डिपेंड्स ऑन द हैबिट, नॉट ऑन द एज, पर ज्यादा
ओके,
उम्र में
तो
ज्यादा देखते
सो ऐसी कौन सी हैबिट्स है, कैन यू नेम 3 हैबिट्स which should be developed in an individual which can avoid oral cancer?
हैं। फर्स्ट ऑफ ऑल एंड द ओनली मेन थिंग इज कि तम्बाकू कोई भी फॉर्म में कंज्यूम नहीं करना चाहिए। दैट इज द मेन एंड मोस्ट इम्पोर्टेंट थिंग।
Okay, so the complete reason behind the particularly oral cancer is tobacco, but we have found out that many women are also suffering from oral cancers. So जो तंबाकू नहीं चबाते, even in the men's, right? So
वुमेन भी इतना ही तम्बाकू खाते। I have seen a lot of my patients, जो women हैं, they still have tobacco, पान मसाला, गुटखा, any form, वुमेन में वो चिकनी ऐसे सब वो सब चीजें ज्यादा कॉमन होता है, वो सब देखते हैं, तो उससे भी होता है।
ओके, सो बट इसकी ट्रीटमेंट किस तरह से होती है? किस तरह से इसको कम किया जा सकता है, और या तो फिर मूड से नाबूद किया जा सकता है?
अगर इनिशियल स्टेज में प्री कैंसर स्टेज में जो हमने साइंस डिस्कस की, वो साइंस में अब चले जाए डेंटिस्ट या प्रोफेशनल के पास, और अभी डिटेक्ट हो जाए, तो हम फर्स्ट ऑफ ऑल तो प्रिवेंट ही कर सकते हैं कि कैंसर हो ही नहीं, और क्विट कर दो आप हैबिट, वही है। उसके अलावा अगर कैंसर हो गया, तो स्टार्टिंग के स्टेज में अगर आपका अ, पता चल गया स्टार्टिंग के स्टेज में, तो फिर हम वो कीमोथेरापी, रेडियोथेरापी ये सब कर सकते थे, जिससे हम ठीक कर सकते हैं। इसके अलावा अगर आगे का स्टेज पहुंच गया है, तो सर्जरी से ठीक करना पड़ता है। वो पार्ट जो जहाँ भी कैंसर होता है, उस पार्ट पूरा पार्ट निकाल देना पड़ता है। और तो बेसिकली ये सब बहुत ही लॉन्ग प्रोसेस है। इससे
ओके,
ठीक हो
ओके,
जाते हैं, पर रीअकरेंस के चांसेस भी रहते हैं कई। तो
ओके।
नॉर्मल लाइफ तो बहुत डिफिकल्ट हो जाती है पर कैंसर, क्योंकि
सो
सर्जरी के बाद भी लाइफ इतनी अच्छी नहीं।
या करेक्ट, करेक्ट। सो जैसे कि आपने सही से बताया कि इट बिकम्स वेरी डिफिकल्ट फॉर एन एनी इंडिविजुअल। तो जैसे आपने ऐसा कौन सा चैलेंजिंग केस रहा है जो आपके डेंटल करियर में, with respect to this handling oral cancer. It could be, or it could be normal, but it could be most challenging to deal with.
Um, एक one of my patients उनको आगे के सारे दांत वो डीप बाइट जैसा मतलब ऐसे ऐसे बाइट था उनका तो नीचे के सारे दांत उनके पूरे गिर गए थे सिर्फ मूल्य रहे थे आगे में पीछे के दांत परफेक्ट कंडीशन में और तो उनमें पूरा ऐसे पूरा बाइट हमको रेज करना पड़ा था और आगे आगे में हमने वो रूट केनाल करके फिर वो पोस्ट एंकोर करके आगे बनाया दांत बनाया था और पीछे के दांत सारे दांत का पूरे माउथ का कैप बना के और 3 भाग में कैप बना के पूरा बेबी रेज करना पड़ा था तो वो थोड़ा इंटरेस्टिंग केस था मैं चैलेंजिंग नहीं कह सकती पर इंटरेस्टिंग केस था वो थोड़ा tricky था
या आपने 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 अभी दो तीन टर्म यूज किए। एक तो रूट रूट कैनाल आपने किया, राइट? सो ये रूट कैनाल किया उसका आप थोड़े डिटेल में अगर चीज बता सकते हैं।
रूट
दूसरी चीज
रूट
आपने दूसरी चीज आपने बताया कि कैपिंग किया। तो कैपिंग जो टीथ को किया, क्या ये हेल्पफुल है कोई पर्सन के लिए, या डिसएडवांटेज है फॉर अ लॉन्गर टर्म, या उसके मीन्स के बेनिफिट्स क्या है, वो जरा बता सकते हो तो व्यूअर्स को ज्यादा आइडिया आएगा।
तो उसमें रूट कैनाल मतलब मूल्य की सारवार मतलब जब सड़ा नस तक मतलब अंदर इनर मोस्ट पार्ट पल्प तक पहुंच गया हो तब पूरा नस निकाल के उसकी सारवार करनी पड़ती है उससे मूल्य की सारवार या रूट कैनाल ट्रीटमेंट कहते हैं जो काफी पेनफुल होती है अ, जब पेशेंट आते हैं तब पेनफुल होती है फिर ट्रीटमेंट जैसे जैसे हमने अंदर सारवार करते हैं फिर पेन चला जाता है एंड जब वो नस निकाल देते हैं तो दांत कमजोर हो जाता है इसलिए उसके ऊपर कैप लगानी पड़ती है और
ओके।
पोस्टिंग कोड है जो जब दांत पूरा सिर्फ मूंछा बचा हुआ होता है और पूरा दांत टूट गया होता है तब उसमें वो फिलिंग करके उसके ऊपर कैप बैठाते हैं वो पूरा दांत बनाते हैं और फिर उसके ऊपर कैप करते हैं basically we try to save the natural teeth as much as we can.
So you shared like great insight on that aspect, and like one last question I would ask that many times what people we discuss कि मेरे मुंह में सीमेंट मैंने भरवाया था, तो ये सीमेंट भरवाया था लगाया था जो मुंह के अंदर, क्या ये सेम सीमेंट होता है जो हम दीवालों में लगाते हैं?
No, 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 no. That is very different. It's just a term name cement, but वो glass inomer cement होता है जो दांत पे लगाते हैं. वो अंबुजा सीमेंट जो दीवार पे लगाते हैं वो तो ये पूरा दांत का सेपरेट अलग टाइप का सीमेंट. तो वो तो
Okay,
ब्रिज भी
so
बनाते हैं पर वो वाला ब्रिज और ये ब्रिज में बहुत डिफरेंस है.
okay, so yeah, so this is something different, but it is a beneficiary for an individual.
Yeah.
Yeah. Thank you so much, Dr. Aditi Choksi, for coming on the Nil Dave Talks, sharing all the insights, demystifying many things which commonly people have misconceptions, right? And I think many viewers will start having a healthy oral life after listening our complete podcast. And I think people might start visiting more to your Maple Dental clinic, right, at Thaltej in Ahmedabad. So I think you should give extra discount to the any individual who is visiting your clinic after listening this podcast, right? Special discount should be
Sure,
there.
definitely. For sure.
Yeah. So people who have listened all this complete podcast and have their feedback about this particular episode, then they can share everything in the comment section. And if you're liking the content which you are getting, then you can like and come subscribe our channel, the Nildava Talks, and you can follow all our social media handlers for more information and more discounting things which are getting going to get coming soon. See you until we meet next time.